Let's bring in health expert Seth Denson with GDP Advisors. Seth, the Democrats are really botching their fast-track path to the White House. It's health care. First up, Bernie Sanders. I mean, how can people believe him now? For months, we've been saying the middle class is going to have to pay for a single-payer plan. We said that for about a year. Now Bernie's finally admitting to it. And also, Joe Biden is botching it. He's saying you can keep your plan. That was a big lie from Obama. PolitiFact said that was the big lie of 2013. And Kamala Harris can't explain how to pay for a single payer. Let's show you the montage first, and let's get the reaction.
How do you think healthcare is not free? Right now, we pay for healthcare in a variety of ways. Pretty complicated. About half of healthcare dollars, more or less, comes from taxes.
If you like your health care plan, your employer-based plan, you can keep it. If, in fact, you have private insurance, you can keep it.
Well, part of it is going to have to be about Wall Street paying more. It's going to have to be about looking at how we and what we tax in terms of financial services. That's part of it.
Your reaction, Seth?
Well, listen, what Democrats have proven in the past is that they can pass health care laws, but what they have proven they cannot do is figure out how to pay for it. We've been talking about Senator Sanders' plan since he rolled it out and said that it was going to cost double the revenues to the U.S. government. Finally, he's admitting this, too. I mean, listen, people lie, numbers don't. And Senator Sanders is now having to face up to that. Taxes, taxes, and more taxes.
You know, and Joe Biden has a public option, single payer, inside his plan. I mean, their numbers don't just add up. What's really striking is how the media is not covering what Bernie Sanders is talking about. Not only getting rid of 180 million private insurance plans, he would rip up Medicare. He would rip up Medicaid for more than 70 million people. He would kill the Children's Health Insurance Program for nearly 10 million and more. He would kill labor union health care coverage. Gallup is saying the majority of Americans like the health system and their coverage for the last 20 years.
Well, we've talked about it before, Liz. They're calling it Medicare for all, but it's not Medicare at all. That's marketing over mechanics. Most Americans like Medicare, but this would absolutely gut Medicare. Medicare depends on the private pay system and offers Americans choice. This is government-run single-payer health care. It would cost $3.4 trillion. Current revenues are $3.4 trillion. You can't pay for it. It just can't be done.
Yeah, they're just, the critics are saying that the Democrats are totally misleading the American people with their health care push. Remember the Cadillac tax? The labor unions didn't like it. All of a sudden, Americans had to pay a higher tax if they had a more expensive health insurance plan. Say you had a spouse who had a chronic illness. You had to pay a tax on that coverage. Now the Democrats swore we needed that tax. Now the Democrats saying, we're going to get rid of it. We're going to kill that tax. I mean, how can you trust them when they flip-flop like that?
Well, if you'll remember, I remember when Speaker Pelosi came out when they were debating the Affordable Care Act and said we have to pass the bill to see what was in it. Well, what was in it? The Cadillac tax. And they've been trying to walk that back ever since because, to your point, Liz, the labor unions, a big part of their base, hated this. The Affordable Care Act was meant to bring a higher level of care to Americans. And then what was in it? Well, if you had a higher level of care, you had to pay a higher tax. It didn't make any sense. And they've been trying to walk it back ever since.
Well, elections are coming up, so that's why. Seth Denson, you're great. Thank you so much for joining us.